Take your time and look at the heart. If you look for this diagonal line here on the hearts, you can see it on this one too, see the diagonal? That's called the intraventricular sulcus. It's actually a little groove in the heart muscle, and that's where the coronary vessels lie. And then they're covered with fat to keep them safe. That's on the front of the heart. Okay? The point of the heart, or the apex, is the bottom of the left ventricle. So all of this is left ventricle. Okay? This is right ventricle. Okay? Then the upper chambers, this is left auricle or left atrium. And this flapper here is the right one. Okay? Left, right. Okay? Major vessels that you can see on the heart. Of course, the big one, straight up and down. Right there. That's the aorta. Okay? This first branch right here coming off the aorta, this thing right here, that's called the brachiocephalic artery. That's going to come up and it's going to branch left and right at the shoulders. Okay? And the aorta we know comes up, makes that big aortic arch, right? And then goes down along the spine. Okay? This vessel right here that kind of lays flat across the front of the heart, that's the pulmonary artery. So that's carrying blood out to the lungs, right? Artery away, carrying blood, oxygen poor blood out to the lungs. Okay? The major veins in the heart come back on the back side of the heart. Okay, so here's the back of the heart, so this is the right side. You have a superior vena cava, which is the largest vein in the body. That superior vena cava is draining the head and upper body. Then you have the inferior vena cava, which is bringing blood, oxygen poor blood back from the bottom part of the body. Both of those unite and dump all that oxygen poor blood into the right atrium. Okay? The oxygen-rich blood is coming back through the pulmonary veins. That comes back to the left side. And there are 3 major pulmonary veins that come from the right lung, 2 from the left lung. You can't see that because they cut this so close, so you can't see all the little tubes coming in. You just see one big hole. But all of that oxygen-rich blood then comes back and is dumped into the left atrium. Okay? And if you put your finger in here, you can feel like all these little ridges and stuff on the atrium, because it's muscular, right? That's called pectinate muscle on the walls of the atrium. Okay? That's the major external view. Okay?